Hello everyone, welcome back to my channel, that is Obstetrics and Gynecology Simplified. It's been a very long time. I have not posted videos. So due to some technical glitch, we have not been able to post the videos, and also I've been working in department. So without wasting any time, let's start. Today we will discuss about the basics of obstetrics. Okay. So what is gravida? What is parity? What is the meaning of living children? Okay. What is abortion? These are the basics. You will be asked the basics, that is obstetric index in Viva, as well as the in while presenting the case summaries. You will be asked the how to calculate the gestational age, and what do you mean by gravida, what do you mean by parity. Everything will be asked in Viva. Okay, so let's start. Starting with gravida. See, what is gravida? Gravida is the total number of pregnancies, and it includes both current pregnancy as well as the previous pregnancies. Current pregnancy means how much, if we have to know that how much time the patient has been pregnant. Okay, that means we have to include the current pregnancy. We have to see if the patient is pregnant now or not. So that is the basic one. Means we have to know that the patient is pregnant. If she is pregnant, that means she is gravida. Okay, so it includes the current pregnancy and also the previous number of pregnancies. Okay, previous number of pregnancies, and also it includes miscarriages or abortions, that is spontaneous as well as induced. What is spontaneous abortion? Spontaneous abortion means without taking any pills, okay, without taking any external, without involvement of the external devices or external pills or medications or anything, or trauma, abdominal trauma, the fetus is expelled out. That is called as spontaneous abortion. And what is induced abortion? Abortion can be spontaneous or induced. So what is induced abortion? Induced abortion means she has taken MTPK, that is mifepristone or misoprostol, and then she has induced the abortion. Okay, that means voluntarily. Okay, voluntarily the patient is inducing the abortion. That is called as induced abortion. So that is also included in the gravida, and also the molar pregnancy as well as the ectopic pregnancies. Okay, so in simple words, what is gravida? That is the simple count of pregnancy. Okay, the number of pregnancies. But what we should remember, that presently or currently the patient should be gravid, should be pregnant. Okay, that will indicate G or gravida. Okay, then coming to the P, that is para. What is para? Para means number of pregnancy that reached a viable gestational age. So the number of pregnancies that has crossed the period of viability. So what is the period of viability? In India, we are taking as 28 weeks, but WHO has given some other weeks, okay, 20 weeks. Okay, so but in India, till now, we are taking as 28 weeks. So if the patient has crossed, okay, if the patient has crossed more than 28 weeks of gestational age, that is called as parity. So means it has reached a viable gestational age. Then it includes live birth and also stillbirth, but after viability. Okay, if the outcome may be live birth or stillbirth, okay, or intrauterine death. So maybe she delivers a dead baby, but if it has crossed the period of viability, that will be counted as parity or para. Okay, then it excludes pregnancy loss before viability. So I've told you that what it is excludes before viability. Before viability, that means miscarriages. Okay, less than 28 weeks. Then ectopic, because ectopic will not go beyond 28 weeks. Okay, then abortions, miscarriage, abortion, same. Okay, then it counts deliveries and not the number of babies. So if it does not count the number of babies and it counts only the deliveries, number of delivered, okay, the number of delivered babies after the period of viability, and not the number of babies. So if question is asked, there is a twin pregnancy, delivered at 36 weeks. Okay, so what will be the obstetric index? Obstetric index will be, so listen, first we have to know that is the question is mentioning about the number of previous pregnancies, or if the patient is pregnant now? No, because the patient is not pregnant now, so gravida will be 0. Why? Because patient is already delivered. As she has already delivered, so gravida will be 0, means now she is not pregnant. Okay, then she has delivered. So as the previous pregnancy is not mentioned, we can write as para 1, because twin we don't write para 2, because para 1 number of pregnancies. Okay, so number of pregnancies we are counting, that means para 1. But she has delivered a twin, that means living 2. Okay, that means living children are 2. Also the question is incomplete, because it must have been mentioned, it must mention about what, the both the babies that are delivered, that the twins means 2 babies, so the two babies are delivered and both are live, then we will write as living 2. Okay, para 1 living 2. Or else if only this question is asked twin pregnancy delivered at 36 weeks, then we will write as para 1. Okay, simple. Then next, coming to the living. Then what do you mean by living? Living is number of children that are number of living children that are present. Okay, the live children that are doing well. Okay, that number of live children present is called living. Then twins, in twins we are counting separately. I've told you in the previous example, I've told you that we are counting twins separately, and if one twin dies, then L reduces. Okay, I've told you, if let one, she has delivered. Okay, if patient has delivered twin, that is para 1 and L2. But if one twin dies, then it will be, what will be that? It will be para 1 living 1. Okay, so if one twin dies, then L reduces. Understood? Then what is abortion? Abortion means number of pregnancies ending before the period of viability. Okay, so before the pregnancies ending before the viability, that means less than 28 weeks, we count as abortion. Okay, and it includes spontaneous and induced abortion. I've told you what do we mean by spontaneous and what we mean by induced abortions. Okay, so do we include molar pregnancies in abortion? Yes, we include molar pregnancies in abortion. We include ectopic gestation, ectopic pregnancy in abortion. Okay, then what is the standard format used? The format used is GPAL. Okay, GPAL, gravida, para, abortion and living. And expanding that, we can write that G can be written as GTPAL. Okay, T means term pregnancy, gravida means, G means gravida, T means term pregnancy, that is more than equal to 37 weeks of gestational age. Then P means preterm deliveries, that is 28 to 36 plus 36 weeks plus 6 days. And A means abortion, that is less than 28 weeks in India. And then L is living children. Okay, fine, understood. Then let's solve some question. Let there is a primary gravida currently pregnant. So current pregnancy, that means gravida 1. Understood. Then one full-term pregnancy and normal delivery, and the child is alive. So as the child is alive, that means, and it is given as one full-term normal delivery. So gravida 1 and normal delivery, one child it is there, so and it has crossed full term, that means parity is 1 and the child is alive, so living 1 and no previous history of abortion, so A 0. Then one abortion at 10 weeks, so one abortion is 10 weeks and now the patient is pregnant. Let the patient is pregnant, so it will be G to A1, as there is 1 week, one abortion at 10 weeks. See here, if it is given that one abortion at 10 weeks, only the question is one abortion at 10 weeks, we will not write gravida 1. We will write only abortion 1 because it is already delivered. Already the abortus has been passed out. Okay, so it will be only abortion 1. Okay, then one abortion at 10 weeks and now pregnant. So as now it is pregnant, we will write what? G2, because only one abortion in the previous pregnancy, we will count that also, because in gravida we are counting all the total number of pregnancies. So previous one abortion and this pregnancy. So gravida 2 and the abortion at 10 weeks, it has not crossed the viability. So parity is 0 and no living child. So L0 and A1. Okay, understood. Then one full term stillbirth, and let now she is pregnant. Then okay, let now she is not pregnant. Only one full term stillbirth. So gravida will be 0. Okay, because already delivered. Now there is no pregnancy. So she is not gravid. So gravida will be 0. And then what about parity? Because it is full term, there will be para 1. But it is stillbirth. That means baby is not live. That means L0. And there is no history of previous abortion. That means A0. Understood? Then one preterm delivery at 34 weeks and baby is alive. Okay. So gravida will be 0 because now there is no pregnancy. Patient has already delivered. I don't know why everywhere it is written. There may be some mistake in typing, but just this is not gravida 1. Okay, so because the patient has delivered, it is gravida 0. Okay, then one preterm delivery at 34 weeks, that means it has crossed the viability, so it will be para 1. Understood? And also the baby is live, that is L1, and there is no history of previous abortion, that means A0. Then twin pregnancy delivered at 37 weeks, both babies alive. So what will be? Solve it. Twin pregnancy already delivered. So gravida will be 0. Simple. Then see, I've told you the parity here, it may be twin pregnancy, but the parity will be 1 because we are counting the number of pregnancies, not the number of babies. So parity will be 1 because one pregnancy, their babies are 2. So living and both babies are alive. So there will be L2 and no previous history of abortion. So A0. Then one ectopic pregnancy, one living child. Okay. So see here, gravida will be 0 because one ectopic pregnancy and one living child. If patient has been given extra one line that now she is pregnant, it would have been gravida 3, para 1, living 1 and abortion 1. But it is not given any, the question is maybe incomplete. So just forget about that. Let the question is one ectopic pregnancy and one living child. So what will be the obstetric index? It will be abortion 1 because ectopic we count as A1, okay, or abortion, and one living child. So which has crossed the period of viability. Obviously, if a child is living, she must have crossed the period of viability. That's why she is living. Okay, so cross the period of viability, that is para 1 and living 1. Okay, and these two, 9th and 10th, you solve it and just tell me what is wrong in this formula and comment down in the comment section. Okay, then coming to the gestational age. So this is the most important part. We have to know how to calculate the gestational age because it is very important. Clinically, we have to know the correct gestational age so that we can determine the outcome of the delivery. We can determine when the patient should be induced for delivery, and we have to counsel the patient in that way so that she is able to know that when she's going to have the baby, what is the time, okay, what is the number of antenatal checkups, when she has to do what a test, when the ultrasound has to be done. Everything depends on the gestational age. we have to know correctly the gestational age. So gestational age is very, very important. The signs, symptoms, the probable signs, the probable physiological changes in pregnancies, everything depends on the gestational age. The timing of delivery, the expected date of delivery. Okay, it is very, very important. And if any complicated pregnancy occurs, so in previous cesarean section also we have to know the gestational age, so that we tell the patient that you are having this risk factors where, as you have undergone previous LSCS in the last pregnancy, so we have to admit you prior to the expected delivery date, because there is increased chances of rupture of the scar site. Previously we have done the LSCS, so the scar may be weak and we have to admit and monitor the baby as well as the mother, and so we have to know the correct gestational age. Okay, then how to calculate the gestational age? See, both in previous as well as primary gravida, the gestational age is important. So we have to know the most commonly used method is the LMP, or the last menstrual cycle. So the first date of the last menstrual cycle is taken as the LMP, or last menstrual cycle. Okay, last menstrual cycle, the first day of the LMP, first day of the last menstrual cycle. So how to calculate the gestational age in V? We have to add all the days that has been passed from the LMP till today, till the day we are calculating. So what is the we are having a patient whose LMP is 1st of December 2025. So we will calculate the gestational age. So let's calculate. See, what will be the gestational age? December we have 31 days. Okay, as the LMP is day 1, that is 1st of December 2025. So we will calculate till today is 9th January 2026. So we will calculate. See, December we have taken 31 days, and then January till today we will take 9 days. So we will add this. What is this? 40 days. We will divide by 7. So what is the gestational age? That is 5 weeks, 5 days. Understood? So this is how we calculate the gestational age from the LMP till today. Okay, the number of days divided by 7. So that will come in weeks. So we write gestational age in weeks. Okay. Then the second method, and here the another most important thing is that if you are taking LMP, that is the most common method we use, we have to confirm the patient about her menstrual cycle. That means we have to ask if the patient is having the regular menstrual cycle, so that the gestational age will be accurate, and maybe 3 to 5 days of difference, but it will be accurate if the periods are regular. Okay, then coming to the second method we can do early ultrasound. So by ultrasound, how can we calculate? See, we will do the crown rump length. So if let the baby is here, okay, and this one is the crown and this one is the rump. Okay, sorry, this one, see, okay, this is the crown and this is the rump or tail of the baby. So we will calculate from crown to rump length. Okay, this is the crown rump length, CRL. Okay, so this is the best method and most accurate. Okay, this is the best gold standard. So this is a frequently asked MCQ, that what is the gold standard ultrasound method to calculate the gestational age. We will write as crown rump length or CRL, because it has only a variability of 3 to 5 days. That means if we have done an early ultrasound, that means first trimester ultrasound less than 12 weeks of gestational age, and we have calculated the crown rump length at that time, that will indicate that there will be, see, the ultrasound, the CRL, by seeing the CRL, when we measure the gestational age, that will indicate only about 3 to 5 days of maximum 3 to 5 days of variability. That means the EDD may vary from 3 to 5 days before or after the calculated gestational age by CRL. Okay, so this is the most accurate, and we calculate it by early ultrasound. The more the earlier, the more the accurate. Okay, then the third one is the fundal height. So how to calculate the fundal height? See, fundal height means, what is fundal height? You see, let this is a female line. Okay, let this is the xiphisternum and this is the pubic symphysis. Okay, then uterus, the gravid uterus will be present like this. So this is, let this is the umbilicus. So this is the fundal height. Okay, from pubic symphysis, okay, this is the pubic symphysis, from pubic symphysis to the height of the fundus. Okay, by the ulnar border of the palm we take the from the xiphisternum. Okay, from the xiphisternum we press the abdomen, and when the first resistance is felt by the ulnar border of the left hand, then that is called as the fundal height. Okay, that is the fundus of the uterus is felt. Then what we do, we take this in centimeter. So, and one limitation of this method is that as it is a clinical method and we can calculate the fundal height, we can calculate in centimeter from the upper border of pubic symphysis to the fundal height. Okay, up to the fundus we take in centimeters, and these centimeters, okay, the fundal height in centimeters will correspond to the gestational age in weeks. Okay, so if the fundal height is, let the fundal height is 26 centimeter, so we will approximately term the gravid female as 26. What I have to let it is 24 centimeter, then we will term it as 24 gestational age. Okay, 24 weeks of gestational age. So, but one limitation is that we can calculate it from only 20 to 34 weeks, not more than 34 weeks, and also not below 20 weeks. And also this is a clinical method, so there is much more intra-observer variability. So this is not much reliable, but we can calculate it, and also we can know the clinically we can assess the IOGR, okay, or growth restriction of the babies. Okay, you just remember the about the IOGR and the terms, whatever I am just telling you, just remember. Through the course of time we will be learning in details about all these terms, all the IOGR babies and all everything, and all the management I will be telling you in details, but just remember here whatever I am telling. Okay, then next one is quickening. You know, quickening means the first kick that is felt, or the first movement that is felt by the mother, because due to the movement of the baby. Okay, the first movement that is felt, and this is also subjective and it is also not reliable. Okay, and so maybe the primary gravida patient may be sleeping or something, or may not be so that much active to uh, get the feeling of kick by the baby. So approximately by 20 weeks or 5 months, we if the primary gravida just feels the quickening, that means it is 20 weeks approximately. And multigravida, as she is much more experienced, multigravida means she is having baby, so she is experienced. So by 18 weeks she can feel the quickening. So if first time quickening is felt by primary gravida, that the gestational age may be approximately 20 weeks, and if the multigravida is feeling the quickening, and then approximately the gestational age may be of 18 weeks. Okay, then I just will wrap up this session. Okay, you must be very clear about these topics, because in practical exams also you'll be frequently all the batches are frequently asked about this topic. And also for the clear and better understanding, I've given you the examples, and if any doubt, if cannot understand anything, you just join our Telegram channel. You can get the access to the notes also, And also if you cannot understand anything, just ask in the comment below, and I will be just very grateful and also be obliged to answer you all. And also I will try to give you more examples, more questions on this topic. If you cannot understand this much, just mention down what else or extra do you need. Here I means I have knowingly just skipped one thing, that is in IVF pregnancy, how to calculate the gestational age. I'm expecting you people to just look into that topic and know how to calculate the gestational age in IVF pregnancies, and mention in the comment. And also anything extra you need, you can just ask. And also if you need any more examples on this topic, as this is a very important and very frequently asked questions, you just can comment, and I will make another part to discuss all the questions, okay, that you cannot understand. So keep learning. Thank you.